Hi everyone, welcome back. Today I'm going to review some of my old cases involving composite veneers. Now, composite veneers are not suitable for everybody or for every case. However, you can see what they can do for your smile if applicable. So stay tuned to see all of the transformations because they are going to blow your mind. You might remember this case from my transformation video that I posted a while ago. And this is a patient, this lovely patient came to us a year prior to the treatment with composite veneers. And when she came in, we evaluated her smile and all of her teeth, and we had to really dig into the issue. What I mean by that is see why the patient had so many cavities. Is she doing something wrong with her oral hygiene? Does she have any specific habits that are making her teeth cavitated, basically? So it took 1 year for us to work with the patient and really change some of her habits and the lifestyle, and finally we were ready to basically work on her smile. A lot of patients will want a changed smile in one day. However, some of the patients will have certain issues, aka caries on their teeth, and we need to really investigate the reason why the patient is having all these cavities. Really treat the problem first rather than just give the patient veneers and give the patient a facade of basically beautiful smile, but then let them walk out with problems underneath the veneers. So that's a no-no. First, the dentist needs to evaluate the whole issue, see why the patient came to a situation like this, and then further better their ability to keep their new smile for a long period of time. Of course, the patient needs to trust the dentist, but also the process, so they can see the results in the end and they will really be pleased with what they get. So this is a comprehensive treatment that we provide rather than just veneers. On to the second case, and this is another lovely patient of mine who presented to us with no caries whatsoever. Beautiful, healthy teeth, but she didn't like the shape and the position of her teeth. So after checking both the top and the bottom teeth, we actually proposed that she get braces or some type of orthodontics for both the top and the bottom teeth to change the position of the teeth. However, she did not like the idea of braces on the top teeth, so she asked if we have a different option for the top teeth. She agreed to put braces on the bottom teeth, and also the bottom teeth were basically very out of alignment and she needed some type of orthodontics in order to align those teeth. So what we did was we actually made temporary veneers for the top teeth just to see if we can correct the shape and the position of the teeth a little bit with veneers, with composite veneers, without sacrificing any tooth structure whatsoever. So basically just adding material on top of the tooth structure. And we found that we can get away with that without actually taking down any tooth structure from her teeth. How cool is that? And so we firstly put braces on her bottom teeth, we aligned those, and then after the braces were removed and we had the situation under control and stable, we decided to place composite veneers, so basically aesthetic tooth filling material on top of her upper teeth. So we got a very pleasing result for both us and the patient, but more importantly for the patient. On to another patient, lovely patient of mine, who presented to us with no caries as well. And this is very unusual before and after, but you can see the transformation better in this picture. The patient presented to us with complaints that she didn't like the color of her teeth as well as the shape of her teeth. So after speaking with her about the different treatment options in dentistry nowadays to correct these issues. She also was able to tell me that she did try whitening with procedures, and many times, not only once, and this is the whitest that her teeth could get. Also, she had gone through braces and orthodontics, and she did not want to go through orthodontics procedures anymore. Also, another huge factor why she wanted a beautiful smile was that she was getting married, and we were able to transform her smile with composite veneers in one day. And you can see the transformation for yourself. We were able to change the color and make the teeth whiter, and also change the shape of the teeth exactly how she wanted. This other sweet patient of mine came in to see me not liking her teeth. And the reason why she didn't like her smile was because she said that her teeth looked very small and short and had gaps between. So, after evaluating her smile, of course, yes, she appears to have gaps between her teeth, as you can see, and also shorter teeth. But the best treatment for this procedure is, before we do any veneers, any restorative procedures, is actually to see if we can lengthen the teeth while taking out some of the gum. That way, we don't necessarily change her smile or make her teeth bigger than she should have, if you know what I mean. And I will be making a video explaining these types of procedures that are done, which are aesthetic treatments as well. Perhaps it's already out and you can find the link up here. But if it's not, you can subscribe and you will not miss it out. So going back to the patient, she opted out for that treatment. She didn't want any treatment with her gums, and I evaluated her smile closely. So after evaluating both her smile and the bite, I came to the conclusion that we could get away with composite veneers without touching any of the tooth structure that she had. So zero compromising of her tooth structure as well. So this is the before and after. That's her changed smile. And as you can see, I mean, it's quite of a change, isn't it? Here's another lovely patient of mine, and I mean, all of my patients are lovely, so I'm going to say that for every case that I have. I have amazing patients, what can I say? So back to the patient. He came presenting with very healthy teeth, and he was quite confident with how healthy he kept his teeth all his life, but he wanted to change the smile and close the gaps between his teeth. After I told him that orthodontics is the best option and the most conservative option in dentistry to close the gaps and change the smile, he was very adamant about no orthodontic procedures. He works with lots of people, he has meetings all the time. He said that he wasn't comfortable choosing either regular braces or something like Invisalign. He just said that he will not go forward with orthodontic treatments. So we, of course, analyzed his bite, his smile, and we did trial veneers for him as well to find out that we could do composite veneers without sacrificing any tooth structure either. So as you can see, it's quite of a change, and he was happy with the results. So from this stage, he can always go to porcelain veneers if he wanted to. So composite veneers also will serve as a trial. Also, I haven't mentioned, but for all of my patients that I did composite veneers, I did make a night guard which will protect their veneers at night when they sleep. It's very, very important. A lot of patients are bruxers or grinders. They grind their teeth at night, but they're not aware of that. And also, a lot of the times I find myself, if I ask them, oh, has anyone ever told you that you grind your teeth at night? They say, oh, no one's ever said that, or I sleep alone. And so there's not really any way of knowing for sure if they are grinders or not. So we do make a night guard at the end of each treatment. That way the patient can wear at night and protect their veneers. More on night guards on one of my next videos, and if it's out already, I will be linking that as well. This is all for today's video. I hope you enjoyed. I hope it was informative. I hope it was fun and you learned a thing or two about the actual clinical appearance of the composite veneers. If you ever considered composite veneers, or if you have any questions that I didn't address, please comment down in the comment section below so I can answer and maybe make a future video answering those questions, because I feel I'm forgetting something. We're all human after all. I'm sure you'll understand. As with any YouTuber, you know what to do. Subscribe and like.